So I think now CLL has a very good options of treatment, and in the era of CLL or expert of CLL, what we see is that our unmet need are the patients with CLL who develop Richter transformations, who still has a overall survival which is less than 1 year. So happily, there are a lot of clinical trials that are going, and we also have one clinical trial, which is an investigator-initiated clinical trial, which are the combination of 3 drugs, all is chemo-free regimen, and we are combining the use of Obinutuzumab with Ibrutinib and Venetoclax. The unique of the study is that we are using a rapid ramp-up of the Venetoclax, giving it in 10 days ramp-up instead of 5 weeks because of the aggressiveness of the disease. We have recruited 12 patients, and in our experience, there was a quite nice response after 3 months when we evaluated the patients. But after 6 months, most of the patients relapse, and we think that it will be a good regimen to use as an induction, but then we'll need to switch for allogeneic or CAR-T or other immunological mediated therapy to get a more effective and long-standing efficacy for the patients.